Hello, everyone. Thank you for tuning in and participating in the Wellness Wave brought to you by the ACP Southern California Region 3 chapter. My name's Jay. I'm currently a second-year medical student at the Mayo Clinic, Arizona campus, and today I have the privilege of speaking with Dr. Juliana Kling. Dr. Kling, can you tell us a little bit more about yourself and what it is that you do?
Yeah, absolutely. And thank you so much for including me in this initiative, and a huge shout out to the ACP group that's organized it. COVID has taught us many things, and one of those is the importance of prioritizing wellness, particularly for us in healthcare. So kudos. As you said, my name is Dr. Juliana Kling. I'm an associate professor and women's health internist, the chair of our Division of Women's Health Internal Medicine at Mayo Clinic, Arizona. I also have the privilege of serving as the Associate Chair for Equity, Inclusion, and Diversity for the Department of Medicine here in Arizona. And my clinical practice, I think, is very exciting. It's kind of a mix of things. I do primary care for a lot of different people, mainly cisgender women, but men and transgender people, and then do consults in the area of menopause, sexual dysfunction, complex contraception, and breast disease.
Awesome. And that's a lot of things you got going on there. So how did you end up choosing this specific career path within medicine?
Yeah, no, that's a great question. That's the $1 million question all of us have going into medical school, right? Like, what is our path? And sometimes it's not clear right at the beginning. I think the thing that was clear for me early on in medical school is I knew I wasn't going to be a surgeon. So that made it a little easier. Yeah. As I explored all the non-surgical specialties, I really fell in love with internal medicine. I love taking care of adults and the complexity of care that goes into internal medicine. There's nothing like solving a great diagnostic question, which you get a lot of in medicine. I think what brought me to women's health is that both before medical school and then during medical school, it was really a priority to me to advocate for others. And I did a lot of social justice work, particularly around women's health and women's rights. And so when it became clear that there was an area of focus within internal medicine where I could take that kind of dedication and interest to advocating, it just all came together. And that's what I get to do every day in both my clinical practice, my research, and my education. So it's a great field. Probably some that are listening didn't even know that women's health internal medicine existed, and it's not an accredited subspecialty, but it's a perfect fusion of expertise in an area with internal medicine.
Yeah, it's great that you were able to kind of merge all of the things together into one thing. So with that, what advice do you have for, current medical students or even residents that are kind of trying to figure out what that path might look like for them?
Yeah, I think it really follows my path. I would encourage people to do something similar, find the things that bring you joy and just, really light up your heart and fire you up, and find a way how you can do that in medicine. And there are a lot of creative ways to do that, but that's, how your job really becomes your career, and it doesn't feel like work, like it's just dedication. And you're just so excited to do what you do, which is what I feel every day.
Yeah, you brought up some of the work that you do and research. Do you mind expanding a little bit more on what you like to focus on in terms of your research?
Yeah. Uh, that was one area that I didn't think I was going to get into when I was in medical school, and doing residency at Mayo Clinic, which is an institution that really integrates clinical practice, research, and education. I had the opportunity to work with just amazing leaders in the field in women's health, and have since been able to really focus on areas like sex and gender-based medicine. So the idea that sex is a biologic variable and gender is a social construct likely influence everything in medicine and healthcare, but historically we haven't evaluated those variables. And so a lot of our research is focused on that. I've done a lot as it relates to women's health and pituitary ovarian hormones and cognition and things like that. some of the interest that I think is really exciting has to do with education work, including our work in the LGBTQ space, but also about human trafficking and intimate partner violence. So how we do a better job really instilling and educating future medical physicians how to be aware of these important concepts.
Absolutely. And since we're focusing this month on wellness, and as I am starting to go into my STEP study period, I wanted to ask you, do you have any tips on how do we remain happy and balanced during these intense study period moments?
Yeah, what's funny is I was just texting with my two kind of closest medical school buddies today. And one was preparing a lecture for medical students, and as was I at the time, and the others at a meeting. But I was reflecting on our time studying for step one, and we'd spend about 10 hours together in the same room. But we're so close. So I think that, looking back, the relationships, the authentic connections with people going through the same thing as you is so critical, and realizing that that's just as important as, recognizing or memorizing all the things you need for your step. And then we had a blast when we took that 15 minutes to take a break. We would go and have, dance parties in the micro lab and things like that. So don't take yourself too serious, but it's just a great experience. I look back on medical school and it was some of the best times of my life. So I hope the same, for you, Jay, and for everybody else that's watching this.
Awesome. Well, as we wrap it up, do you have one final piece of wisdom or nugget you would like to impart on anybody watching?
Oh, just one.
Just one.
That's challenging. I would say, sometimes medicine can push you or make you feel like you have to change. There's a pressure thinking about all the medical school debt you have, or I don't know, being the best at something. But at the end of the day, you have to do something that makes you happy, you have pride in. So whatever that is, find a space to be able to do that in medicine, and just carve it out and move forward and make it work.
Brilliant. Well said. That's a great way to end our interview. Thanks so much for sharing all of this advice, and I hope anyone that's tuning in will also enjoy it and appreciate it. And
Absolutely.
with that, we'll end the interview.